In this part of the course, we look at the first aid actions for medical emergencies, including difficulty breathing, choking, heart attack, bleeding, and stroke. Your actions in the first few minutes when you see the signs of any of these conditions could help save a life. Breathing. It's usually smooth and easy. We run, play, go about our daily lives, and hardly even notice it. But if someone suddenly has trouble breathing, it's an emergency.
Let's go! Move up! Move up!
Antonio, pass!
Shoot! Nice! That's more like it! Josh? Josh, are you okay? Is it your asthma? Okay, where's your bag? Okay, hang on.
You can tell if someone is having trouble breathing if the person is breathing very fast or very slowly, is having trouble with every breath, has noisy breathing, you hear a sound or whistle as the air enters or leaves the lungs, or can only make sounds or speak no more than a few words at a time in between breaths, although the person is trying to say more.
Is this the right medicine? There you go.
Someone with a medical condition, such as asthma, usually knows about his own medical condition. He often carries inhaler medicine, which can help him breathe easier within minutes of using it. At times, the person can have such a hard time breathing that he needs help using his inhaler. For this reason, you should be ready to assemble the inhaler and help him use it. To assemble an inhaler, first shake the medicine. Put the medicine canister into the mouthpiece, remove the cap from the mouthpiece, attach a spacer if there's one available and if you know how. To help someone use an inhaler, have him first tilt his head back slightly and breathe out slowly. Have him place the inhaler or spacer in his mouth and push down on the medicine canister, and then breathe in very deeply and slowly. Then have the person hold his breath for about 10 seconds, and then breathe out slowly. Also, it's important to know that there are different kinds of inhaler devices. To summarize, follow these steps for someone who is having breathing problems. First, make sure the scene is safe. Ask the person if he needs help. If he does, ask if he has medicine. If he has medicine, get it for him and then assemble and use the inhaler. Phone 911 if the person has no medicine, the person does not get better after using his medicine, the person's breathing gets worse, the person has trouble speaking, or the person becomes unresponsive. Provide CPR if the person becomes unresponsive and stops breathing or is only gasping. Stay with the person until someone with more advanced training takes over.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look.
If you look at page 2, there's a high-level view of the company. Actually, you know what? I think I have my own copy. Right here. Are you choking? Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away and try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around the person's waist so that your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrust instead of abdominal thrust. If you give someone thrust but cannot remove the object blocking the airway, the person will become unresponsive. Watch to see how this might happen and what you should do.
Sir, can you help me lower him to the ground? Phone 911 and get in the AED.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on a speaker mode so that you can talk to the dispatcher. Provide CPR if needed, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep as the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Your soccer team's doing great this year. You still enjoying it?
I like it and all, but I'm not as good as some of the other kids.
It takes practice just like anything else. Your mom and I were thinking about sending you to a soccer. Are you choking? I'll help you.
Choking in children is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the child can make sounds and cough loudly. In this case, stand by and let the child cough. If you're worried about the child's breathing, phone 911. If the block in the airway is severe, the child cannot breathe, talk, or make sounds. The child may also make the choking sign by holding his throat. If this happens, you need to act right away and try to clear the airway. When a child has severe choking, give thrusts slightly above the belly button. If the child is smaller, you may have to kneel to get into correct position. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. Act quickly by doing the following. Are you choking? I'm going to help you. Stand or kneel behind the child and place your arms around the child's waist. With one hand, locate the belly button. Then make a fist with the other hand and place the thumb side of your fist against the child's abdomen, just above the belly button and below the breastbone. Grasp your fist with your other hand and press your fist into the child's abdomen with a quick, forceful upward thrust. Repeat thrusts until the object comes out and the child can speak, cough, or breathe, or becomes unresponsive. If the child is too large for you to wrap your arms around the waist and his choking is severe, put your arms under the child's armpit and your hands on the center of the child's chest. Pull straight back to give thrust on the chest instead of the abdomen. A child who has been given thrusts should see a healthcare provider as soon as possible. If you give a child thrusts but cannot remove the object blocking the airway, the child will become unresponsive. Watch to see how this might happen and what you should do.
Help me lower him to the ground. Phone 911 and get an AED.
If a child with severe choking becomes unresponsive, lower the child to a firm, flat surface. Shout for help, phone or have someone else phone 911, and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, leave to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions, until the child starts to respond or until someone with advanced training arrives and takes over. Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrust to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you pushed during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up on a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out or the infant starts to respond, or until someone with advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. This concludes the section of our course on choking. To sum it up, you've learned the difference between mild and severe choking, how to help an adult, child, or infant with severe choking, and what to do if an adult, child, or infant becomes unresponsive when the choking is severe. It's important to act quickly because your actions can make a difference. Allergies are quite common, but if severe, an allergic reaction can quickly turn into a medical emergency. Symptoms of mild allergic reactions are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or signs of shock. An epinephrine autoinjector is a prescribed device that has medicine in it. The autoinjector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine autoinjector, he will generally know how and when to use it. You may help give the person the injection if you have been trained and your state allows it. In a moment, you're going to practice using a spring-activated epinephrine pin. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention because you'll be demonstrating the same steps to your instructor afterward. First, make sure the scene is safe. Phone or send someone to phone 911 and get the first aid kit and the AED. To use the epinephrine pin, follow the instructions on the pin and make sure you are holding the pin correctly. Hold the pin in your fist without touching either end, because the needle comes out of one end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. Hold the pin in place for about 10 seconds. Pull the pin straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pin to paramedics for proper disposal. If the person doesn't get better, or if there is a delay greater than 10 minutes for advanced help to arrive, consider giving a second dose, if available. Okay, now it's your turn to practice using an epinephrine pin. While the video is paused, you'll pair up with a partner and take turns practicing, and then your instructor will test you after.